For more on all of this, Myriam Laaroussi joins us from Al Ganeina in West Darfur, Sudan. She's the emergency coordinator in Darfur for Doctors Without Borders. Myriam, it's really good to have you on the program. We appreciate you taking out the time to speak to us. What is the current situation in Darfur, especially with the measles outbreak? What are you and your team seeing, and what is most urgently needed right now?
Thank you for having me. So what we're seeing inside of Darfur is that there is a huge outbreak going on right now. So we're talking about more than 1,300 cases from the MSF data, so between Zalenji, between El Geneina, between Yala. We're talking about a disease that is preventable. We're talking about an outbreak that could have been stopped before if the immunization was going on. Now, due to many factors, but mainly logistic, access, transportation, the vaccines for measles never arrived on time, and we're seeing now a situation that is very critical. While it could have been stopped, it could have been prevented.
Myriam, at this point, what are the scale then of the healthcare services and the shortages and humanitarian assistance across Sudan? Because it's been more than 2 years of this instability, but the Darfur region in particular, where you are, has long suffered from conflict and food and aid shortages.
Well, the first thing that we have to say is that really there has been like a huge insecurity toward the medical mission. We're talking about 650 incidents against the medical mission since the beginning of the war. We're talking about 160 health workers that have been killed. So really that's the first thing that we have to consider. Beside that, yes, I mean, hospital has been attacked, health center has been attacked, and this has really decreased the response capacity for all the organization and the Ministry of Health. So now, this being said, we're trying to upgrade our capacity to respond to the need, but the needs are extremely important. The first thing is really the access to food. I mean, when it comes to El Fasher, we're talking about a siege that lasted more than 500 days with barely no access to food inside of the city. So we're seeing level of malnutrition from the people that managed to escape El Fasher that are very high. But this situation is not specific to El Fasher, it's specific to all Sudan. We're talking about level of famine inside of all the country. I mean, more than 1 million people now are suffering from famine. So when you add that situation to other things such as access to water that is extremely reduced, access to healthcare that is reduced because of insecurity, but also because of the capacity of the different organizations, plus all the disease that could be prevented, such as measles, but also such as cholera, that we've been through a cholera outbreak during all the summer, and we went really from cholera to measles. I mean, it creates a situation that is extremely critical. A child that has measles, it's one thing, but now we're seeing children that suffer from measles together with malnutrition, and that really increases like the probability for this child not to recover.
Yeah, it's really a dire situation, and a lot more, it would seem, is needed now from the international community to help this. Thank you so much, Myriam Laaroussi, for explaining to us what's happening in Darfur. Really appreciate it.